We would like to take another moment to thank our sponsors, whose financial support helps make CapTimes Idea Fest the important event that it is. Special thanks to our presenting sponsor, UBS, the Burrish Group. They have been a major sponsor since the very first Idea Fest. Major sponsors include HealthX Ventures, Exact Sciences, and Quartz. Co-sponsors are Madison Gas and Electric, Godfrey & Kahn Law, the University of Wisconsin-Madison, and Epic. Our Friends of Idea Fest sponsors are Wisconsin Alumni Research Foundation, Madison Community Foundation, University Research Park, Cargo Coffee, Doc Smokehouse, and Forward Theater Company. Our media partners are the Wisconsin State Journal, Madison.com, WKOW Channel 27, and Hinckley Productions. Again, we thank you for your support and for making Idea Fest 2021 a huge success.
Hello, I'm Paul Fanland, editor and publisher of the Capital Times, and I'd like to welcome you to CapTimes Idea Fest. This is the festival's 5th year and features both live and virtual sessions. Our theme is Reckoning with Change, and there has certainly been a lot of that. Staging Idea Fest is always a big lift, and we couldn't do it without our generous sponsors and CapTimes members. If you're not already, I hope you'll consider becoming a member. Members help shape events like this one and support an independent local media organization at a critical time. Find details online at membership.captimes.com. You'll find other festival videos and information too at captimesideafest.com. I'd like to thank the Burrish Group at UBS, which once more is the presenting sponsor of Idea Fest, as well as our many other sponsors. This session explores how the pandemic will continue to affect our lives and features the state's top health official and University of Wisconsin experts. It is sponsored by the Wisconsin Alumni Research Foundation. We very much appreciate WARF's support, so please enjoy the conversation.
Welcome, everybody. We're delighted to be a part of the Capital Times Idea Fest. We're going to talk today about how the COVID-19 pandemic will shape our lives, continue to shape our lives in the future. A very interesting topic. We have a very distinguished panel here, by the way. I'm George Smith from 27 News, WKOW. We have Dr. Jim Conway, Professor of Pediatrics at UW-Madison, also Associate Director of the Global Health Institute. In the middle right here on the hot seat, Secretary-designee Karen Timberlake from the Wisconsin Department of Health Services, and Professor Ajay Sethi, Associate Professor of Population Health Sciences at UW-Madison. I guess I wanted to throw out a question that all of you can touch on, and maybe we'll start with you, Ajay. Just your thoughts on what's happening with COVID right now before we talk about how it's going to shape our lives.
Yeah, first, I think, we've come a long way. And we have sort of two communities that are out there, a group that's vaccinated, feeling comfortable about returning to normal. And we have a group that's unvaccinated that also might be feeling comfortable about returning to normal, but potentially facing the consequences of not taking those precautions. And, seeing what's happening in the healthcare system where most of the people who are hospitalized are unvaccinated is kind of where we are right now. We have to convince more people to choose vaccination.
Karen?
Yeah, I'm happy to build on that. So right now we are adding about 1,500 new COVID infections every single day in our state. And the last time we were at that rate of new cases was back in January of this year. Ajay's absolutely right that the overwhelming majority of those people who are getting newly infected with COVID have not been vaccinated. And the other thing that we have to talk about is that the fastest, or I should say the most significant rate of new cases is in kids ages 9 to 13. So as we look at our data and we look at the age breakdown of just case rates per 100,000, who is coming down with COVID most frequently in our state right now? It is our kids. And those kids under age 12 cannot yet be vaccinated. So that's one sort of perspective on where we are. In terms of our hospitalizations, we're kind of holding steady right now at about 1,000 people in hospitals across our state with COVID. About 300 or so of those 1,000 are in our ICUs. And while we're not yet at a point where we've got pressure on hospital capacity for the rest of us who might need hospital care, we don't want to get there. And that is, I think, the most important thing for folks to recognize about these vaccines is that they are safe, they are effective, they are doing an excellent job of keeping people from getting seriously ill and from ending up in the hospital. Last thing I'll say, maybe to sort of tee this off on a slightly brighter note, is in terms of vaccination, so all across the state, we have given more than 6.2 million COVID vaccinations just since December of last year, which is remarkable. We've reached more than 3.2 million people in our state. Here in Dane County, we continue to lead the state with overall vaccination rates. We've got, in particular in Dane County, 94% of people 65 and older have been vaccinated, which is just fantastic. And even 70% of 12 to 15-year-olds have been vaccinated here in Dane County, which is also excellent. But it is the case that we have a ways to go still in this county and certainly across the state. So some signs of concern, some signs of optimism, and more work to do for sure.
Thank you.
Yeah, and I'll sort of take it in a different direction and just sort of maybe take a 10,000-foot perspective. You know, we have learned so much over the course of a year and a half of this. And I think the public has seen science done in a transparent way, and I've unfortunately probably also dealt with the fact that science sometimes needs to be done repetitively before you really establish what are the facts. And so I do think that there's been an element that we've seen, understanding that people have been confused by some of the, what they can perceive as mixed messages, which has really been just an evolution of what we know and what we ask people to do. And so I think that that's been, you know, sort of a historic moment in many ways in living through a pandemic where we have social media and the internet, where things are readily available for people, including for people to try to make their own conclusions from what's been posted and shared. And I think that's been part of the challenge for all of us, is trying to help people understand that something doesn't become an established fact until you can reproduce it over and over again, and then it's something that you can act on. And so we get this kind of mix of people wanting to act on things quickly when there's a glimmer of an idea, rather than being patient and waiting. And on the other hand, people, you know, sort of being frustrated waiting for there to be conclusive ideas and evidence. You know, we've certainly seen science be able to work with government to actually develop things in a really novel way, to develop policies and programs. You know, the fact that we were able to figure out a way to minimize the bureaucracy of vaccine development and yet not cut any corners on the safety and efficacy trials, and realizing that if we work together, we can actually make these things work in a much more efficient way than they ever did in the past. And I'm hoping that as many people are thinking about these things, you know, we've been in a cloudy world for many, many months, but there's always going to be silver linings to that cloud. And I think that we've discovered and found ways to manage things in a really effective way that I hope will actually stick around. But I think part of it is also going to be rebuilding trust in how people sort of think about science and government, and think about that collaboration of how they work together. The other piece is obviously, you know, in some ways we should sort of be happy to, we can declare victory that in many ways we eradicated the original strain of SARS-CoV-2. I mean, when you look at where we are right now, 99% of what we're seeing is a new virus, is this Delta variant. And so I think we should be confident in the fact that we actually have the tools available to manage these things. We know how to manage social movement. We know how to get people to understand at least what the ideas around masks are, although clarifying those messages is challenging. We now have the tools to control this with vaccines. And so I think all those pieces are in place, but it is somewhat depressing and a little frustrating to be a healthcare provider to feel like you're back in Groundhog Day living it all over again. And it is, I mean, the fatigue on my colleagues' faces as we talk about and recognize that we're basically doing the exact same things we were doing back in January and back in the fall, yet it's tragic and sad that at this stage this is all preventable. Like in the beginning this was, we're not sure what we're dealing with and we're going to do the best we can. It's just sad that there are so many people still suffering from something that we consider to be something we actually have the tools to manage.
Let me start with you on this question and then go right down the line. How are you feeling now compared to when this first began?
Yeah, I think in the beginning it was both fascinating as an infectious disease specialist to be sort of seeing this thing unfold, but it was also a little terrifying that it was something so novel that we didn't even understand how is it transmitted, aerosol or droplet, and who's getting it, and why are these people getting sicker than these people. And so I think there was a lot of just consternation and anxiety about dealing with this and being the people that are responsible not only for caring for people and not knowing how to treat them, but also trying to help people understand what it is that we were dealing with. And so I think it really sort of brought us together and realized that collegial teamwork was really going to be the best approach to this. I think then we've been sort of happily kind of moving forward from a scientific standpoint and making such progress that I think there's actually great pride in the academic and scientific communities that we've figured out a lot of this in a much faster timeline than any of us ever anticipated. But I think now there's this frustration and really fatigue and almost a level of depression that there are so many people, for whatever reason, that aren't availing themselves of these opportunities to be protected or have been misled by either misinformation or sort of political priorities that are then suffering from something that is really very preventable.
And I would really pick up on a lot of those themes and say that, you know, if I think about from the perspective of the state health department and the work that we do every day, we have gotten to a place where we know what our role is in the pandemic. We understand that we're here to help communicate information. We're here to help coordinate with partners, like our partners in medicine and in higher education, and certainly in local public health and local healthcare and pharmacies and schools and community organizations. So we take a lot of pride in playing that role. I also think that among our team, we have a sense of optimism that we, just as Jim said, we have the tools, we know what to do, we're seeing what works and how it works, and we're able to disseminate that more fully. And we're also seeing that there's always going to be a gap, right, in public health between what we know and what we do. And this is one of those cases, as with so many, where that gap is causing serious illness and death that is absolutely preventable. And so that's the challenge. And if I'm concerned about anything, I'm concerned about just the duration of effort that this is requiring from all of the people who are on the front lines in all the ways that Jim talked about. I'm concerned about the fact that we still have very persistent racial and ethnic disparities in who is getting sick, who is ending up in the hospital, who is dying, who isn't getting vaccinated. I'm sure we'll talk more about that. And I'm concerned about the ability, in particular, of our local public health and our tribal public health leaders to have the support that they need from their local communities and from the people on whose behalf they are working so hard every day. There are a lot of challenges coming their way in the face of this just really strong body of evidence and science and data and facts about what to do. And so I think all of us have a role to play in supporting those folks who are on the front lines, and however we choose to define that, and making sure they can keep doing the work we need them to do day after day to keep all of us, all of our families, all of our loved ones safe.
Yeah, I'll say that at this point, I'm pretty hopeful. I mean, compared to a year ago, when we weren't exactly sure if there would be a vaccine that could be rolled out. And so just with that reference 1 year ago, I feel good where we are. I recognize that, you know, the vaccine hesitancy that's out there and some of the slowing of the rollout at times is frustrating, but I don't think anybody would have said that we would have vaccinated everybody overnight. That the pace kind of represents a distribution, and as an epidemiologist, I think of sort of, you know, the patterns of things, and there was going to be a slowdown. But it's also picked up, unfortunately, because people are feeling a greater sense of urgency because of the Delta variant. Some people who were holding out on being vaccinated are now seeing loved ones get sick and severely ill. It's unfortunate if you need a negative experience to make a positive choice of getting vaccination, but this is kind of the way society works sometimes, right? So it's not surprising. And so overall, I feel very hopeful that, and very just thankful that we have safe and effective vaccines that remain highly effective against every variant that's emerged. I also like knowing that scientists and the government and the vaccine manufacturers are on top of, the need for boosters or maybe an updated vaccine. There are a lot of people who are just working very hard. And if I take myself back to the very beginning of the pandemic, a lot of my fear and worry was, are we going to be able to handle this? And I feel like now we're handling this, and our job now is just to get everybody in the community to be on the same page.
Give me a sense of historically, we've had other big diseases. How is the vaccine hesitancy different now compared to in the past?
I can say that it feels like things have been politicized a lot more with COVID than previous pandemics. But I began my career studying HIV, and that's something that certainly became politicized. But a vaccine never became available to think about vaccine hesitancy. But there certainly was a lot of disinformation and misinformation and just general confusion out there, and maybe real mixed responses from different agencies at the federal level. So in a lot of ways, I see parallels with COVID to HIV. But now we have this vaccine, and the hesitancy, as Jim would say, and would know that, it pre-existed COVID. But the politicization of this pandemic and just the wide range in views on what our best response should be has caused a lot of confusion. And people who have an underlying tendency to wait to get a vaccine, will hear what they want to hear to confirm what they believe. And people who are generally trusting of vaccines, even if they have to do a little research, which is not a bad thing to know what you're getting, those individuals are finding those sources that are credible and are able to confirm their hunch that the vaccine's safe and effective, which of course it is. But cracking that nut is really tough. But we see progress, it's just kind of slow.
Karen, what's been your biggest frustration over the course of this pandemic, or several of your frustrations?
Right, frustrations. I don't know that I would put it in terms of frustration. I would put it in terms of the thing that I know we need to continue to do is to be nimble to respond to all the ways in which the pandemic is going to continue to evolve and change, right? So as both of my colleagues have noted, in the early days when we didn't really understand how COVID was spreading, we were furiously, wiping down every surface and sitting close together in conference rooms, not wearing masks. And let me assure you, we still care about wiping down surfaces, but we are wearing masks when we are in our building. The early challenges were around testing and making sure we could get adequate testing out there and available to people. Now we've kind of gotten over that hill, not that we don't have more work to do, but obviously then the challenge was getting the vaccine rolled out and making sure that was available in every corner of the state. So I think a thing that I know we need to continue to work on ourselves, and we would ask, our friends in the media and our friends in the general public to be thoughtful about as well is, and Jim touched on this, just the fact that this is all happening in real time, it's unfolding in real time, and we're in a more than 24-hour news cycle where, George, you and your colleagues have been covering nothing but COVID for 18 months, pretty much, with a few exceptions. And so, desperate for something new and novel and something to talk about, which from our perspective, it's not always necessarily the most, helpful message that we need people to know, because at the end of the day, the core messages are still get vaccinated, wear a mask, stay away from crowded indoor gatherings and without a mask on for sure, stay home when you're sick, and I'm sure a thing we'll get to, get your flu shot, which again, we'll come back to that maybe by the end. So I think it's just that need to continue to stay on our toes, meet the challenge of the moment, and have a little bit of patience and space and grace from all of our partners as we all work together to figure this out.
Jim, we're talking about how the pandemic is shaping our future. And Karen mentioned something earlier about the young people getting that. So I guess my question to you would be, what advice would you have to parents of kids who are not able to get vaccinated, 8, 10 years old or something like that, what reassurances, what would you say to them?
Yeah, it's obviously a point of great concern, across the board for all of us, whether you're a pediatrician or a parent. I think we've recognized that it's a disease currently of the unvaccinated, and with a large proportion of kids being unvaccinated because there's no vaccine available, they are bearing the brunt of this. And so again, we have the tools. The parents and the household members need to be vaccinated. We know without any question that the majority of kids that come down with it because they acquire it in their homes. Now, they certainly can transmit it in schools that aren't able to maintain social distance and aren't masking, but the primary epicenter of the ongoing pandemic for the kids is really in their own households and in the immediate surroundings of the people that they cluster with. And so it's extraordinarily important for parents and all of their bubble of friends and family to all be vaccinated. That's the best thing you can do to protect your kids. Obviously the other things are when people are indoors and in close contact with each other. Masks certainly do protect from, especially the people that are shedding and don't know that they're sick. I think that's the one part that has been a little bit tricky, especially with Delta, is that you can have people that are either minimally ill or not even ill at all shedding virus. And so, I think people have misunderstood the whole idea of masks as being something that solely is done to protect ourselves, and understanding that many of these masks don't do a great job of filtering everything, but they're just as important, if not more important, in preventing what we call mouth rain, is essentially the sputum and droplets and aerosol that come from people as they talk and sing and all these kinds of things. And so if you want to do two things that are important, immunize everybody that kid is around, make sure that they're masked and everybody that they're masked is masked with them in close contact, and then stick with this idea that we really have been, I think, as a society, far too bold and far too cavalier about doing things when we're sick. And we've learned this in medicine as well. I mean, doctors and nurses were the worst at this. There was a poll that came out some years ago that 90-something% of doctors and nurses admitted to going to work sick. But because we're heroes, and my colleagues are going to have to all bear the brunt of it. We all have to get over that. And I think part of the benefit of all of this is we've learned that we can control a lot of other diseases. We had almost a non-existent flu season last year, largely because of masking, being careful about things, and people taking that seriously. And I pray that we don't lose that, and that becomes a new societal norm, that people don't put other people's lives at risk just because we're stubborn.
George, if I can build on that real quick, I took a call on a radio show a couple of days ago from a gentleman who said, I live in Rhinelander. You want to know why I haven't been vaccinated yet? I've heard that you can have some side effects and maybe I'm not going to feel so great for a day or two. And the company that I work for doesn't give me any sick leave, and I won't have any time off. I can't afford to stay home and if I'm sick. And so I'm going to roll the dice and I'm going to take my chances. And so I'm not going to take this safe and effective vaccine over the cost of a potential 24 to 36 hours where I don't feel so great because I don't have an employer that will support me in that. So I think as we really think about, sort of where we are right now and what is ahead of us and what are the next few things that everybody needs to ask themselves that they can do. Jim gave you a great list for, parents and household members of young kids. The challenge that I would offer to our employer community is, what is our employer community doing to make sure that it is possible for everybody who works for you who is eligible to be vaccinated, which is everybody at this point, over the age of 12, to get vaccinated, to have a little bit of time off if they're not feeling well, to have the support that they need from their employer to really get that done. We have got to clear away every remaining barrier, and that's one of them.
Yeah, I'll react and say that when employers moved away from paid sick leave to paid time off, it just really disincentivized people staying home when they're sick. And it's just a real unfortunate thing that's happened over many, many years, which we need to go back to paid sick leave, which was developed decades ago because of respiratory infections that were spreading in workplaces. And it was also seen as something that workers would respond positively to. We've got to think about people who have that occupational risk, and if you don't have the means or the ability to stay home when you're sick, I think that's really unfortunate.
For any of you, how has COVID changed how we'll teach, how we'll learn, how will it impact the education system going forward?
Yeah, I'll start just because everybody looked at me. I think it has underscored a couple of things that I think we've suspected or known for many years but didn't have clear evidence. One is that kids really do need to be in school, and that school is as important from learning content as it is to learn to be socialized and to be able to work and play and cooperate with others. And I think we really do worry about the mental health of kids in this current environment that they've come through, that now they're actually stressed about being around groups of people, that many of them gotten so used to being sort of staring at a screen that being interactive with other people is a challenge. And the longer that goes on, the harder it is to undo it. So I think that's been one of the things that we certainly did in the beginning because it seemed like the prudent thing to do. But I think now that we've pivoted as pediatricians and people that are advocates for kids, that we need to get them back into some sense of normalcy where they can actually make and establish friendships and understand how to deal with authority figures. All those things are critical. And it's been a challenge because nothing in this life is without risk. And so as soon as we start having people in clusters of, indoors especially, we understand that there is risk associated with that. And I certainly understand every teacher and every parent having some trepidation about turning these kids back out and loose into the wild again and putting them at risk for acquiring these things. And so I think that we need to sort of balance these things and understand that we're going to have to make some concessions to mitigate the risk for the time being in ways that nobody's happy about. I don't like wearing a mask. You don't get to see my stellar smile and my good looks. But this is part of the burden that we all have to bear as we try to get society back to what it needs to be. The other is that we also have learned, and again, I'm going to go back to silver linings, there are a lot of things that I think we're going to adopt and keep that may actually be very useful. Some of this virtual learning stuff is actually going to stay around and actually I think is very positive for people that have very busy schedules. Being able to do things on the time that works for them, to be able to catch up and view lectures and review things, I think is going to be really positive. The meetings, we used to spend time shuttling all over campus to try to manage meetings. I think the efficiency of those kinds of things, and I think there's an element of that works for schools and certain school organizations that they'll be able to adopt. But I think it's hopefully a temporary measure until we have vaccines widely available for kids. But I think that we've learned that we need to get those kids into school and do it in a safe way that's really sort of a positive for everybody. The other piece of it is obviously the impact on the economy of parents then having to manage their kids and what that's done, especially to working mothers, has really, talk about highlighting an inequity and a disparity, who's kind of borne the brunt of that. And a lot of these single parent homes and working moms have really sort of suffered themselves from all of this. And so I think we've realized society is sort of this, Jenga game where everything sort of fits together, but as soon as you start pulling pieces out, it starts to get a little wobbly. And so I think we need to think broadly when we're designing sort of our approaches and our policies to make sure we're encompassing not only the immediate proximal threats, but also the secondary threats of both the disease we're worrying about, but also the policy changes we're making, and what are the other secondary impacts of those.
Yeah, I would build on that and go back to a phrase that we've used already today, I think, which is that we have the tools to keep kids safe, kids of whatever age, right? So whether we're talking about our 4K or whether we're talking about university students, and I have a high schooler and a college student in my family. So we have the tools, right? We have vaccine for 12 and up, we have masks, we have the ability where we can in our largely older school buildings in some cases to kind of keep kids physically separate from each other where it's safe to do that and where we can do it. Use as much outdoors time as we can while it's still decent weather. But I want to go back to saying we have the tools and we have to be willing to use them. And those tools do include masks, and they do include being respectful of quarantine requirements, and they do include finding ways to keep children home when they have been exposed and they need to be in quarantine or when they themselves are sick. And Jim's absolutely right that there is a whole support structure that doesn't really exist adequately for too many parents in our society around affordable childcare and the ability to have those supports that families need to be able to do what they need to do for their kids. And so that is among the many breaks and fractures in our society that COVID really served as an x-ray to help us all see if we hadn't already been experiencing it. I will also say that just speaking personally as a parent, I have never been so appreciative of school staff and the challenges that they are really navigating through again, I can only speak for my family, but I want desperately for my kids to have a school year this year that is like the school year that they had a couple of years ago and not like the school year they had last year, as hard as everyone tried to make that workable. There is no question that we need to be doing whatever we can as the adults in the room to support our kids in having as typical a year as they can possibly have.
One other thing I wanted to emphasize that Karen said before that I didn't mention was that people also need to take advantage of the opportunity and the need to be tested. That I think that there has become at some level a little bit of a disincentive that people just don't want to know because they don't want to deal with the isolation quarantine issues. And I think that's the other piece that I probably failed to mention is that people do need to make the school thing work, to be willing to put themselves out there and go and get tested or get their kids tested so that we can actually act on those. I think that there is a responsibility in addition to staying home when you're sick, but also identifying, are you one of the unfortunate folks that may have picked up COVID, even if you're vaccinated, because it does have ramifications for others that need to be understood. And so I think that's the other piece that we need to make sure we emphasize.
And that's a big part of our current response. Just to tie that up quickly, we are working with hundreds of school districts all across our state to offer them free testing so that they can use it in the case of symptomatic kids or if they want to do routine screening of kids and staff. Whole program built out around that just in the last couple of months here.
I'll comment on teaching in a university environment, and UW-Madison has a very high vaccination rate, which I think everybody's now know that it's 90% on average of people are vaccinated. Faculty are 99% vaccinated. Students are approaching 90%, maybe even exceeded today. Staff also well over 90% vaccinated. It's going to be an exceptionally safe environment to teach on campus. And this time last year, fall 2020, when the university began teaching in person and there was a spike in cases, the contact tracing never showed that the cases were being transmitted in a classroom environment. They were being transmitted out in the community where there were gatherings, people not wearing masks. And that's kind of the same as what we've seen generally. COVID transmits when you let your guard down and you're in a social setting and you think you can take the mask off and you're not sort of maintaining that physical distance. Now, a year later, we've got an indoor mask requirement. We've got very high vaccination rates. I'm not expecting outbreaks in the classroom. So I feel exceptionally safe teaching. My first class, the first day of my class this semester is this evening, and I'm looking forward to it.
All right, we're going to take a break. We'll be right back.
We would like to take another moment to thank our sponsors, whose financial support helps make Cap Times Idea Fest the important event that it is. Special thanks to our presenting sponsor, UBS, the Burrish Group. They have been a major sponsor since the very first Idea Fest. Major sponsors include HealthX Ventures, Exact Sciences, and Quartz. Co-sponsors are Madison Gas and Electric, Godfrey and Kahn Law, the University of Wisconsin-Madison, and EPIC. Our Friends of Idea Fest sponsors are Wisconsin Alumni Research Foundation, Madison Community Foundation, University Research Park, Cargo Coffee, Doc Smokehouse, and Forward Theater Company. Our media partners are the Wisconsin State Journal, Madison.com, WKOW Channel 27, and Hinckley Productions. Again, we thank you for your support and for making Idea Fest 2021 a huge success.
Welcome back. We're talking about how the pandemic will continue to shape our lives. And the question I have for all of you is, how has COVID changed your life personally and professionally? Who wants to go first?
I can get started.
Okay.
So personally, I've had the privilege to be able to work remotely from home. And obviously that was an adjustment to that new lifestyle. COVID also has given me a lot of purpose professionally, being an infectious disease epidemiologist. So working from home has also really allowed me to efficiently work But it's also exhausting at the end of the day when you have nothing but back-to-back meetings that are remote. That was, more than a year ago, and now I'm transitioning to working back on campus, some at home, some on campus, and it's nice to be around people again and to just be social, and it kind of actually slows down my day a little bit, just because I do need to build in that time to go from one place to another. It feels good, where things are. But otherwise, I feel like the fear and uncertainty that me and a lot of people were experiencing 15 months ago, all of that is pretty much dissipated. Now, I feel, again, very optimistic and hopeful, but my fingers are crossed. They remain crossed that moving forward that we can continue to make all the progress that we've already made.
The way I would answer that is to say that for me, it's really been a blend of the personal and the professional. So I changed jobs because of the pandemic. I decided to come back to the Department of Health Services this past January. As the governor said, could you come back and help kind of see us through COVID? And I've been joking that maybe I should have negotiated just a little harder about what see us through COVID might actually mean. But obviously, I'm privileged to have had the opportunity to make that switch, and I did it deliberately largely because of my children and other people's children. I did it because of vulnerable family members that are part of my family who are immunocompromised and are going to have a hard time living a normal life if we don't get this thing under control. And I did it because I felt like, with the benefit of some of the experiences that I've had over my career, I could come back and provide some support to this incredible team at the Department of Health Services and everybody that we work with across state government, across local government, and with our private partners to try to help see them through the pandemic as well. So for me, the personal and the professional are inextricably linked.
Yeah, mine's been very interesting, and it's interesting we've got such a contrast of people and professions here. I mean, from a personal standpoint, as these folks know, I'm a social animal, and so really understanding and knowing how important human connection is. Our families are people that bars and restaurants and shows and all those kind of things, and losing those was a sense of loss, but it also established sort of the need to find joy in whatever you can, and so realizing that there's other ways to connect with people and family and friends, and finding ways to do that and creating our own bubbles of social organizations. Taking the time that would have been in a bar and restaurant, and I've spent a lot of time on my bicycle when I wasn't working to just kind of blow off steam, and that's been very fulfilling. From a professional standpoint, I kind of wear three different hats in my world, and so as a pediatric infectious disease clinical physician, obviously it's been rather challenging. I've been in the hospital, and in clinics pretty routinely throughout the entire pandemic, treating COVID patients, managing people's fears, managing sort of the concerns about COVID. And so that's been, that part's been almost unchanged in that's just sort of what you do as an infectious disease physician, with the exception that, we wear masks all the time. Started to recognize that eyes are actually the most important part of how you communicate with people in many ways. And when you look at medical textbooks, they have pictures of patients, they always black out the eyes. I always thought that was sort of interesting, but you realize eyes are really the defining feature. So the clinical part has been, challenging but interesting, and hasn't changed a lot. The other two pieces of my life have really become both more of a moral imperative, but also more consuming. One being that I work on vaccines and vaccine development and vaccine system strengthening and vaccine distribution. And so, there's been sort of a clock ticking in everybody's head. We got to get this done. And so it's been amazing to sort of work with and bring together teams of people, whether it's with pharmaceutical organizations, working with public health, working with other kind of global partners, to really sort of make vaccine stuff work and understand. The other major change, though, has been the hat I wear as a global health professional, and working with projects in 12 countries on vaccine systems work, as well as kind of global health education. And so at some level, there was a big pause to all of that, because my life before used to be I was out of the country about 1 week each month, and that has completely evaporated. But as we look for silver linings, we've been able to pivot, and a lot of our partners in many other countries have had to figure out the same things we've had to figure out. And so I don't think that I'll be taking nearly as many trips even as the pandemic unwinds, because we've figured out how to have these kind of meetings and seminars and conferences virtually with our international partners. It's been hard for students that we're counting on global health opportunities, but we've also started to realize global health is in your own backyard. I mean, global health is really about under-resourced populations and communities that are in challenge. And so we've realized that there's plenty to be done in our own backyard throughout the state of Wisconsin. And so I think our students have actually really kind of thrived in many ways in finding other ways to do things that are valuable and meaningful, temporarily at least, suspending their need or their interest in visiting and working in other countries. So I think we've made the best of it, but I think we're eager to try to get more of it back to normal as well.
I'm curious, Karen, I'm going to start with you. Where do you see COVID a year from now, 5 years from now, 10 years from now? Are we going to have to get shots every 6 months or a year? Where do you see this going?
I look forward to my expert colleagues backing me up on this, but maybe I can start with where I feel like I have line of sight, and I'll let them take the longer term view. I certainly think a year from now, we believe that we can be at a place where COVID, we will always live with COVID. I don't think any of us thinks that COVID will be completely gone. As Ajay said, we've really shifted to dealing now with the Delta variant, and what we have to hope is that we will contain the mutations of this virus so that it'll be Delta and things like Delta where we know how to manage it and our vaccines are effective. And if it gets beyond that, then Jim and his colleagues are going to figure out the next vaccine. So there will always be COVID. I believe that we will get to a place where we will have a sort of predictable rate of cases, right? And then we will need to continue to watch for those spikes and those outbreaks and those trends that are concerning. And as those happen, we may need to respond differently. But I do believe we'll get to a point where people are protected against what we know. And then it'll be a matter of how we respond to mitigate that risk and how we respond as we start to see trends that may kind of change for the worse.
Yeah, I'll say that it's so different in the U.S. versus other countries, and I think as long as COVID is able to spread in some settings unmitigated, you're giving the virus a chance to evolve, and as it evolves, we can only hope that our vaccines will hold up. And so far, so good. A year from now, 2 years from now, 3 years from now. We're now in a position where we need to really, invest even more in just the global surveillance of variants and testing which ones might require a vaccine update. So I think we can get there. There's a process to distribute influenza vaccines every year, to update them, to offer the best guess of what will be circulating. And that same model has to apply to COVID, and I think everybody's ready for it and is working towards that, and hopefully this will become manageable and seasonal in this country. But the U.S. also has to play this really important role with getting vaccinations out in the global community, which we are, but it's slow, and I think. Hopefully we can begin to do that. I'm sure Jim you've got a perspective on that as well.
Yeah, it's a really interesting question, and it's hard to forecast exactly how this is all going to unfold. A lot of it really does depend on what happens with vaccinations in developed countries, but as Ajay mentioned, it's almost as important what happens as we try to get global vaccine distribution. If we don't, this does run the risk of becoming a disease that just continues to keep mutating and rearing its head, and then we're playing whack-a-mole. And I do think that if we actually can figure out a way to coordinate both public health surveillance internationally, but also vaccine distribution, which has certainly been something that we've been working on for 20 years under the leadership of Gavi and other organizations, I think there are opportunities to get more equitable distribution of vaccines where we can get this under control. It's sort of, in a perspective standpoint, we've tolerated as a society flu seasons every year where, some proportion of the population gets vaccinated, a lot choose not to. 20 or 30 million cases a year and, tens of thousands of deaths every year. And that's sort of, in our society, an acceptable range. And I do wonder if people are going to start to rethink that and start to think maybe these respiratory diseases all merit a little bit more attention, and COVID sort of fits into this bigger pot of all these different viruses that we have the means to control and we don't necessarily need to always suffer through. And that maybe we do start to figure out ways to protect those that are more vulnerable to these things. And I think that this is something that certainly in this country, I think is getting a lot more attention. But I do think globally there's a lot more opportunity to coordinate. I think in many ways this has been a wake-up call for public health at some level, but more importantly for governments at another level, to understand the importance of funding the ability to respond to these things, but more importantly the surveillance to actually know when they're happening early so that responses can be crafted. I think we've figured out how to work with vaccine manufacturers and scientists to make vaccines quickly, and to develop them and to do them in a very safe and effective way. But I think there's still that implementation piece that is still in development that we're still working towards. So at some level, I do have some, I've resigned myself that this may end up being an endemic disease that sort of hangs around for a while. But at the other level, I have some optimism, like Ajay does, that this may be the big one that finally gets a lot more attention to these things, that maybe we don't have to suffer with all these things. If as a society we change our behavior a little bit, and if we fund the things that need to be funded appropriately and make this a global effort, then maybe we can manage all this in a way that actually makes life going forward a lot more normal. And a lot more normal routinely, rather than, I think what people have been really frustrated with is this sort of on-off. You know, oh, we're back to normal. Oh, no, we're not. Oh, yes, we are. Oh, no, we're not. I think that's as challenging for people as anything. And I think if we can sort of temper that down into kind of, we behave a little bit differently routinely, but we get the support to be able to do these things in a more broad and equitable way, I think we actually could get this into a manageable thing that it's not nearly as disruptive as what we've been living with even currently.
You mentioned something that I wanted to follow up with Karen on, and that is, I think that the pandemic has highlighted racial disparities. How do you combat that?
Absolutely. Yeah, so what we've seen from the very beginning is that people's chances of contracting COVID, ending up in the hospital, potentially dying, and now the access to vaccine and the choice to get vaccinated, all of those things have had these really stark disparities by race and by ethnicity in our state. One of the things I was noticing in looking at some of the numbers is early on when we saw these widely varying rates of infection by race and by ethnicity, you could attribute some of that to the jobs people were holding and the kind of living situations that many people had. And of course, you know, why do we have more of our frontline essential workers tending to be people of color? We know that there's a whole history of structural racism that has very present day manifestations that cause certain people to have certain opportunities where other people do not, right? So as we've gotten better at understanding how COVID spreads and how to prevent it, what we've seen is that that disparity in who is contracting COVID, those gaps are closing. They are not gone by race, but they are closing. So that tells us that we've learned and we're applying those learnings and we're doing some of what we need to do to distribute that learning equitably across the population. What I think we're also coming to terms with, as we talked about a minute ago, around childcare and the effects of COVID on in particular, women who would otherwise have been in the workplace, kind of same learnings around people's life circumstances, all of the social determinants of health that our colleagues at the university have taught us about, people's housing, people's education, people's access to health insurance, and besides health insurance, a usual source of care. All of those things are what it takes to keep you safe from COVID and to help you respond to it if you get it. And all of those things are not equitably distributed across our communities depending on, again, people's experiences with this long-standing history in our country of racial discrimination. And so I think by, again, silver lining, right, to have those disparities magnified and lifted up and made absolutely impossible to miss, we now have an opportunity to respond. And so one of the things that we've done, for example, on vaccination is to have grants go out to about 100 community-based organizations across our state who are the trusted messengers who have strong relationships with various communities of color or other marginalized or disadvantaged communities in our state. far better for those organizations to be holding vaccine clinics, doing outreach, doing education, conveying the same messages that any of the rest of us would convey through other channels. But by using those trusted messengers and those local community organizations, we are much better able to reach groups of people who need to be reached with that same information.
Let me just tack on something that I think Karen touched on that I think is really important, which is trust. And I do think that there's a significant issue that we've really unmasked about the issues of trust in communities and who are the people that actually are able to effectively convey messages in a way that are both actionable but also that come from a place that is trustworthy. And so I do think that institutionally across the board, I think scientific literacy in communities really needs to be recognized and boosted so that people have the ability to process the information that we need them to act on. But I think we also need to be more inclusive of the people that we're teaching and training and working with those communities to make sure that they feel that they're represented and they feel like they're coming from a place of people that are from within those communities are the people that are then leading the messaging in those communities. And I think that can't be lost. I think these are opportunities that have long been needing to be addressed, and we finally have an opportunity, but a moral imperative and support to actually do that now.
To pick up on that point, one of the other things that we've done is, and hopefully many of your viewers have seen this, but we have billboards and social media ads and paid television ads featuring real physicians, real nurses, real nurse practitioners from across our state, people who are known in their local communities, and we've worked very hard to get a good variety of representation in terms of gender, age, race, ethnicity. And the point of that campaign is to show people, here's a clinician who potentially looks like you or looks like people in your community. Here's somebody whose name, particularly in smaller communities, you may actually know. And the core message in every single one of those ads is this is a care provider that you have trusted to take care of your family in pick a community for all these years. They trust the COVID-19 vaccine. And we've gotten really positive response to that effort, and certainly something we're going to continue.
I'm curious, Ajay, what do you think good has come out of dealing with this crisis?
Yeah, number one, the vaccine, right? And to some degree, I'd say we were lucky. Not all pathogens are amenable to the production of an effective vaccine. Here we're lucky. And what's been really great is just the cooperation and the work it took to develop such a safe and effective vaccine, and for such a high proportion of our society to choose vaccination in less than a year's time. Yes, there are holdouts, but we're chipping away at that. I'd say, in line with the question we just addressed or talked about, we're having these dialogues about disparities and thinking about those upstream determinants more than ever before. And I think just at least starting that is important. I'm hoping it doesn't, those conversations don't cease, because we really do need to make a lot of progress. But I see that as also a very good thing. In general, society has a lot more understanding of public health, even if people oppose public health, and there's this tension sometimes with what people feel like is their personal freedom or right versus what public health feels is important for the health of an entire community. Even though there's tension, there's dialogue. It is talked about every day on the news, and I think people in general are just improving their understanding of what a situation like this necessitates. I don't want the next pandemic, but it's going to happen at some point. And I'm hoping this is going to just help us, in just be able to understand what we need to do when we're in this crisis again.
More good? You're looking
Sure.
for more good examples? Yeah, I was thinking about the infrastructure, to use sort of the word of the decade, I guess, the infrastructure that we have both been able to build but also to rely upon in our state. So to give a couple more specific examples, I want to give a shout out to our pharmacies across the state of Wisconsin who have been tremendous partners with us in testing and in vaccination, and just both the national pharmacies that have been partnering in so much of the work with long-term care settings in particular, but also just literally the local corner pharmacy that has made itself available as almost like a satellite minute clinic kind of operation. Certainly, we've had tremendous contributions from broader, bigger healthcare systems as well, but it's really been those pharmacies that have, I think, been a nice addition to what we've thought about as that front door for people to get the care that they need. I will also say that the ability of both the public sector and the private sector to just adapt and create new solutions. In standing up these mass vaccination clinics all across the state, we've had the opportunity to partner with a company out of Virginia, and this is what they do, and you tell them where you want them to be and how long you want them to be there. They hire people locally. They open a great professional vaccine operation. It's, completely well organized and well run, and that's a thing that perhaps we will need again in the future, but it's been great to have that capacity and be able just to see it really built out. And then I think also the sort of neighbor helping neighbor, community organization helping community, figuring out what the needs are, whether it's for school supplies or for food distribution, particularly early on when we had everybody sort of retreat to their homes, and just seeing the capacity and the desire that people have to really continue to help and support one another. And we're going to continue to need that as we manage our way through this.
Jim, any positives?
Well, it's tough to be the cleanup hitter after two home run hitters ahead of me, because they hit a lot of the major points. I mean, I guess the one that I'll point to is that in many ways, I think when this all started to unfold, I think a lot of us were pretty worried about exactly where this might go. And I think that in many ways, this highlighted that actually we were probably better prepared for these kind of things in some ways than a lot of people give credit for. The fact that we actually had the infrastructure and scientific development in the background that we could so quickly have vaccines into testing, already by early summer, spring of 2020 was pretty remarkable. The fact that people knew, after having studied and worked in public health for decades, like who needed to be tapped and who needed to be mobilized and how you do these things. Like I think that we actually have a lot more resources and a lot more capacity and capability ready to be brought to the bear. And as Ajay said before, like I think the public's much more aware of public health. I do think that at some level, this will hopefully heighten people's awareness of the fact that there are these threats that are out there continuously. And I think that, we've seen them raise their heads and not amount to anything significant, with Ebola or some of these other past concerns, that I think people were able to sort of look and see that a response actually did manage to keep those things contained and keep them from spreading widely. And so I think that we've seen effective things. I think that, we need to continue to sort of highlight those successes, because I think there is, now that we're sort of back to where we feel like we've done this before and we're not happy about it, I think there is a tendency for people to sort of overemphasize the negatives. But I think overall, in many ways we've actually done really quite well, and have also had an opportunity to develop a lot more conversations around the importance of community, the importance of managing underserved populations, the importance of being a global economy and a global community where we need to think about others. I hope and I think that a lot of that will stick around. The other thing, as I mentioned, is just the messaging of how we do this. I think we've realized that this is a different era than the last pandemic of 2009 H1N1 flu, that social media is a much more powerful force than I think people really completely understood. I think we were sort of in a nexus where, as a political force, that was clearly becoming much more evident in the last few administrations, but I think we've realized that that's also a powerful force in public health, for good and for bad. And I think that, for many public health organizations, they've sort of leaned on and worked more closely with the traditional media like yourselves and the print media. And I think understanding the importance of social media and the strength of that voice, and the need to really combat the misinformation that's there. I think that there's been some very interesting studies that have come out recently that highlight the fact that the majority of misinformation comes from a very limited number of individuals that unfortunately just gets broadcast and amplified. and understanding how that social side of this works and understanding how we get people accurate information. I honestly don't think that people that are confused because they're bad people. I think they're confused because they're trying to actually educate themselves. It's just that they're not able to discern what's the source of the information and which ones are credible and which ones aren't. And I've got very well-educated friends from across the spectrum who struggle still with understanding all of this because there is so much out there and people are thirsty and trying to process it and make their own decisions. And so I do think that one of the things we're going to learn, and I have some optimism, is that there's going to be better messaging, that we're going to learn how media does this responsibly, how government organizations do this in a way that's actionable, and then trying to meet people where they are with where they get their information. I think we can do a better job of that, and I think we're moving in that direction.
Quick question for you, Jim. We've seen Zoom, that's a big change. Working from home. Telemedicine is one that comes to mind. How do you feel, is that good or bad going forward?
Yeah, it's interesting as a clinician because obviously we pivoted to that in a big way early on, and I think we realized quickly that it's very advantageous for certain things and it's a real detriment for others. So I do think that there's, just like we all feel socially, being in a room with people, that there's a connection and a meaningful interaction. I think for patients, especially people that are struggling with really important diagnoses, that it's just not the same as seeing a flat screen with somebody expressing their empathy. And I think there is real benefit in certain circumstances. But I think what we've realized, as a multi-state organization here, we see patients from 5 states, that for a lot of patients that I'm managing, making them schlep, 4 hours in a car just to take a look at the kid and say, yep, things are going well. I think there's a middle ground there. And so I do think that we're going to be able to find, again, some silver lining, and that there are going to be opportunities there that I think should stick around. I'm very hopeful, although a little concerned at some of the discussions, that insurers and other major payers are going to back away from that, and we're going to lose that opportunity because for many patients, it's either a telemedicine visit or no visit. And I think something is better than nothing in those settings. So I do think that the clinicians, along with their patients and clients, need to make those decisions together. But I think we can do that, and we've actually gotten much better at that in literally having our nursing and scheduling staff talking to the parents and say, do you think this needs to be in person, or do you think that you'd be comfortable talking about this as a telemedicine visit? And then likewise asking the physician, is this a visit? And so sometimes one trumps the other, and so, we have to say, no, I really need to see this patient in person. So I think it's going to stick around in some limited fashion, but I think it's going to be an important and really incredibly powerful tool to maintain connection with patients, especially those with chronic diseases, so that we can maintain connection in a convenient and useful way for them over a long, long period of time.
We have just a couple minutes left. I have one more question I want to ask each of you to address briefly. Just how do you feel personally? What do you say to your family and friends about travel, going to restaurants, movies, concerts? Just share a thought on that as we wrap up.
I'll say my parents are elderly. They live in Maryland. Invited to a wedding in October, and I think they want to go. It's a family friend's daughter who's getting married. They're both vaccinated, and I said, well, if in the indoor environments, definitely wear a mask, and maybe just check to see if they're asking guests to be vaccinated coming in. But I suspect there are going to be a lot of people vaccinated there. And my advice to them is, let's just take it 1 week at a time, and at the time. There's nothing wrong with going because you know how to protect yourself and you've been vaccinated. But if you're uncomfortable, that's okay not to go too. It's just up to you. For me personally, again, I just judge every different social situations differently. I've been traveling recently, went to California to visit friends, and those are important things to do, and you can do it safely.
Yeah, I would build on that and say we'll stick with the theme of use the tools that are in the toolbox. Get vaccinated, wear your mask, don't go if you feel sick. I've also been thinking about it lately with the analogy of, can you drive safely on an icy road in a Wisconsin winter? You can, but you're going to have to do a few things differently, right? You're going to have to slow down a little bit, leave a little extra time, maybe don't drive, in the dead of night, make sure you've got good tires on your car, all those things, right? That's the same idea with the tools that are in the COVID toolbox. If we pick them up and use them, we can do many things safely. If we leave them by the wayside, we're going to expose ourselves to a whole lot of risk that is just absolutely unnecessary.
Yeah, I agree with those. And just 2 brief things. One is just personal responsibility, is people sort of just taking responsibility for their own health and their own actions and using these tools. The other is communication. is communicating with the people that you're around and the people that you're going to be with, and agreeing that you're going to be all on the same page with things. I think the most uncomfortable social situations are those where some people expected that they weren't going to be wearing masks and some people were absolutely expecting that they were, and I think those get a little bit confusing for people. And so I think that there needs to be agreement on how do we manage these things together. But I think we can do it together. I think communication is really important.
I could talk to you guys all day, but we have to wrap things up. Thank you, all of you, for being here.
Thank you.
Wonderful
Thanks,
discussion.
Thank you.
Yeah, thank you.
We would like to take another moment to thank our sponsors, whose financial support helps make Cap Times Idea Fest the important event that it is. Special thanks to our presenting sponsor, UBS, the Burrish Group. They have been a major sponsor since the very first Idea Fest. Major sponsors include HealthX Ventures, Exact Sciences, and Quartz. Co-sponsors are Madison Gas and Electric, Godfrey & Kahn Law, the University of Wisconsin-Madison, and EPIC. Our Friends of Idea Fest sponsors are Wisconsin Alumni Research Foundation, Madison Community Foundation, University Research Park, Cargo Coffee, Doc Smokehouse, and Forward Theater Company. Our media partners are the Wisconsin State Journal, Madison.com, WKOW Channel 27, and Hinckley Productions. Again, we thank you for your support and for making Idea Fest 2021 a huge success.